At the World Health Organization meeting being held in Islamabad, Pakistan, adolescence took precedence. We have with us the Director of Health Promotion, Dr. Maha El-Adawy. Welcome to the program.
Welcome to
Dr. Maha, what happened? Suddenly we find adolescents taking a lot of interest in this meeting. What brought this about?
Okay, let me first tell you, adolescents, just for people to know, are those between 10 and 19 years of age.
Very important, critical age.
It's a very critical age. Adolescents have always been important, but we were not able to prioritize the needs because we were very busy with the very high maternal mortality and the very high childhood mortalities. So we have come to realize that we have neglected a group that has a lot of problems, health problems. We have not addressed traditionally because they were not dying, but I mean they were suffering elsewhere. And in general, they are healthier than the rest of the population.
So they weren't getting enough interest.
They were not getting enough interest. But we realize now that we have to address them. Otherwise, we lose a lot of opportunities because this will be the adults of the future.
What are the main causes of death at that age?
Okay, let me tell you. In our region where we have conflicts, of course,
disasters and conflicts.
I mean, yeah, disasters, national disasters, they die of this. But the most important cause is actually road injuries.
They drive like mad.
They drive like mad. They're on motorcycles, in bicycles. They cross the streets without looking. They're always exposed to danger.
So road safety has become a major component.
It is the most important component when we talk about adolescent mortality. Other things come like respiratory infections and some of the childhood illnesses that continue into adolescence, they also cause.
Do you also address things that relate to their mental health as a whole? Is that?
Mental health is actually, let's say, it's not a cause of death, but it's a cause of disability, I would say. And of course, at this age, it happens a lot. We did a lot of surveys, and we have strong data that bullying is happening in schools.
Absolutely.
In some of the countries in the region. Bullying leads to depression, alienation, sometimes even suicide.
Yes.
So, or thinking about suicide. So this is important. It also makes them drop schools. They don't continue with education. There are many other issues also that affect their mental health and well-being. For example, substance abuse.
Oh yes, this is something not to be forgotten.
No.
Smoking and substance abuse.
It starts at this age. It starts during adolescence. And I'm very sad to say that our region is showing the highest rate of increase in smoking among adolescents compared to all the other WHO
Everybody else
regions.
is going down and we seem to be going up.
Yes, unfortunately, and among girls and boys. Another cause of death among girls, early marriage, early pregnancy, and childbirth complications. So this is another thing we have to look at.
Yes, in the area this is happening, and we really hope that we can counter that because it really leads to a lot of complications. Dr. Maha El-Adawy, before I end, I want one last question. You are leading a very important component, which is health promotion, which is simplifying all the health messages to the public. Amongst them all, what is closest to your heart that you want all the public to know?
That's a difficult question.
They're all my babies, right?
Let me focus on adolescents, who have been one of the issues we focus on. Okay, so let me say that we need to focus on the age group of 10 to 19, because if we improve their health, their education will be improved, their participation in the society will improve, and we will be able to reap all the benefits of the demographic deficit.
Thank you so much, Ahmed. We know now that adolescents are a high priority. Drive carefully, please, and keep away from substance abuse and especially smoking.